Hi, this is the lab prep for our wound lab. This will be including assessment of wounds, drains, and alternative dressings. The prep for this lab will consist of 3 Mosby Skills videos: wound assessment, changing a dressing, and using different wound drainage devices. Chapter 34, it would be a good thing to review prior to coming to lab, and we also have a tutorial on F.A. Davis. The website is right here, and it's called it's a wound care tutorial. It's pretty good. I like it. Please review prior to coming to lab the types of wounds, and you can see I've just listed some here: abrasions, abscess, contusions, lacerations, punctures, tunnels. All these are descriptors of different types of wounds, and just please be able to understand those, because we will be talking about them during lab. So, please also review the healing process. You can find this in Chapter 34. And you do need to understand that process in order to understand wound care, because the type of dressings that we use depend on the stage of healing or non-healing for that, and the type of wound that there is. So please come to lab prepared to be able to do that. And remember, this is kind of old news to you, but surgical asepsis is sterile, medical asepsis is clean. Okay, and sterile again means the absence of microorganisms, and what I want you to note here is skin is not sterile. And so when we do dressings, many times, depending on where you are, you'll use a clean or no touch technique versus a sterile technique, and we will be discussing these in lab, and there's different times when you would do different types of dressings. Wound care does require an order, and a lot of times those orders are, the physicians will actually turn to the nurses and say, what is it that you need? Or the nurses may see something different in the wound and say, we need to try something else. So it really is a collaborative effort. And you do need two things when you do dressings: protect your patient, and you're protecting your patient from bacteria and harmful bacteria that's in the environment, either in the facility or hospital, and you also need to protect yourself from whatever might be in that wound. So it's a two-way street, and you have to consider both of those items when you're doing wound care. And it's all about the nursing process, and I really like the way this really does work. But we're going to be going over assessment, planning, intervention, and implementation, evaluation. This would go great into a nursing care plan or concept map doing wound care, because this is what you do, and this is how you evaluate it. First off, assessing the patient, and you really look at the whole patient, not just the hole or the wound itself. What's going on with the entire patient? What are the patient's concerns? Are they worried that the wound, they might lose their leg because of an ulcer in the foot? Or is this something that is body image sensitive person, and this is something that's a new wound, and there's been a sudden change in their body image? How old is the wound? Is it new? Is it old? Very different in how we would take care of it and how we would address it. What are the patient's comorbidities? Comorbidities meaning other things that are going on, like diabetes, obesity, cardiac issues, let's say circulation issues that may affect wound healing and create wounds also. The nutritional status: just because someone is obese doesn't mean that they're healthy. They are not healthy. Or someone that's very thin cannot be healthy too. We really need to look at what is the protein in their diet, what's their albumin level. There are labs that we need to look at to say, because if they have low protein, low albumin, then we're going to have a major challenge getting that wound healed. So we really do have to look at the whole patients, and what medications, if any, could interfere with wound healing. Let's see. Know your terminology. This slide I put together, I just put words on a page, but each word here is a descriptor of some type of wound, okay? Whether we're talking about the skin, or we're talking about the healing, we're talking about the type of wound it is, peri-wound, all that. So please know your terminology. You may want to look some of these up. We will be using these. You will be using these in our lab also, because you're going to be doing assessments of wounds, and you're going to have to use the correct terminology and create that written documentation on how to describe the wound. So I got you started here anyway. You have some to go with. Now, this may be upsetting to some, but when I said look at the whole patient, not just the whole, literally I meant that. What we're looking at here is probably a diabetic foot. And you can see we have pink skin, but you would take a look at it and you need to probe the wound. There is definitely tunneling here. And if we hadn't probed it, we wouldn't know what we would be working with. And this person's wound definitely would be getting worse instead of better, because we change how we deal with the wound based on what the wound actually is. So you can see this it's a pretty tough one. I hope you don't see too many of these in your career, but it is not unique. Know your drains and how to care for them also. This person here is probably fresh out of surgery, and you can see this is what we call a Jackson-Pratt drain, and you can see that the dressing is here. It does look like it's intact in that there's no drainage around the dressing, and this device actually drains the wound. And in draining the wound, we're keeping that area where the deficit is. If it ordinarily would have to reabsorb that, and reabsorption would slow healing. So we have found if we drain that area continually, that the healing process is much quicker and better. And in this case, we can see this is sanguineous drainage. This is probably close to pure blood because this is a fresh patient. I don't see clots in here. And you can see that this Jackson-Pratt drain, we will practice this in lab, has a suction on it, and it's collapsed, and you can see that. And in doing so, it provides a slight suction to bring the drainage out. So understanding what your drain is, why you have it, and how it works, and most definitely how to care for them is in our purview. And it's what we do, because if we don't care for these well, then the wound won't heal as well, or there may actually be even complications. And you're the eyes and the ears for the surgeon, the physicians. You're the one that actually is on the front line. This wound here is a hip wound, and you can see that actually you have staples in here. You have some bruising where this person had the surgery, had some internal bleeding, and when that's normal with a surgical process, and that blood kind of comes to the surface, and there you have ecchymosis. So that's actually looks like a pretty good wound. Now up here, I can see there's some edema. And in this one here, we have some pitting edema. So there's definitely some swelling around in the area. And when you have swelling, that means there's fluid between the tissues, and that can impede healing. So, but it's a common occurrence when you have a large wound like this. It's a big surgery. But when I look at this, I say, okay, it's not the straightest wound in the world, but it actually looks pretty good. It is not, I can see that it's dark here, but it's not red, it's not purulent, there's no leaking here. You can actually see a little bit of crusting right here. So when I look at that, I see a pretty good surgical incision, and that's healing well. It's just going to take some time. So that's an example of an acute wound. What you're looking at here is a chronic wound, and you really need to, when you take a look at this, it's probably a diabetic foot. You can see that this person has lost their toes. But when I look at this, I'm going, now is this healing? Well, when I take a look at it, you can tell it's an old one because of all this darkness around here. It's been healing for a long, long period of time. And here's granulation tissue. All right, so I see in the peri-wound area some granulation tissue. I'm thinking, now that's pretty good. This person, there may be some progress going on. Yeah, there's some little bit of drainage here that might need to be taken care of, but overall, that's not looking too bad in the scheme of things. But what I wanted to impress upon you here is that it's your accurate documentation when you evaluate this, because you change the dressing, you measure it, you do the depth, you do the width, you do the description, you do the colors, and that sort of thing. The next person coming on relies on that description in order to be able to say, okay, this person is improving or this person is not improving. So again, wound care is an art, and it's developed over time. So develop your wound skills and know your resources. You're not out there by yourself. We do have some great wound nurses, and they are certified, they have special training, but they also are our resources, because we're at the bedside and they come and they can really make recommendations and help us with doing the best wound care. And there's all different types of wounds. We'll be looking at these types of dressings in our lab. So for the skills lab itself, we will be doing wound assessments, and you'll be documenting that. We'll have stations where you'll be looking at the types of dressings, and then at the end of the lab we will have a simulation where you actually can go and do dressings in a simulated setting. So that's lab. This is the prep, and I hope to see you in the lab. Any questions, you can always see me. Thank you.